Hello and welcome to the latest episode of Inside 340B Report. I'm Ted Slavsky, publisher and CEO of 340B Report, and I'm joined today by Associate Editor and Senior Writer Shannon Young and Associate Editor and Senior Writer Will Newton. We're also joined by National Correspondent Bella Chakowski. Hello, everyone. How is everyone doing?
Hey, it's great to be here.
Great to be here as well.
Good. Thanks, Ted.
Good. Well, so glad we're here and getting an opportunity to melt the snow in Washington and get ready for, I think, some more snow next week. I think I'll be out of here before that happens, but I looked at the forecast for Nashville where I'm going to give a talk, and it looks like it's going to be colder than even in DC. So maybe that was a mistake, but I'll live with it. So today we're going to be talking about a bunch of issues that have occurred in the 340B space over the last week or two, including a number of bills that have been introduced at the state level to protect contract pharmacy access. We also have others that would require 340B providers to report a lot of information about how they're using the 340B program. A lot of providers would say a lot of those requests are overly burdensome, and we'll learn more about those today. We're also going to talk about a dark money campaign that has been targeting many of the state contract pharmacy access bills and the GOP members who are supporting those initiatives. Finally, we'll update you on what's happening at the federal level, including key updates on who's going to be leading important healthcare agencies in the new administration, and talk a little bit about what might be happening next when it comes to 340B legislation in Washington. So, Will, to start out, can you tell us about some of the bills you've been reporting on at the state level?
Yeah, definitely. So right now we're just about a month into the 2025 legislative sessions, and we already have 16 different states at least that have introduced bills that would prohibit drug makers from restricting covered entities' access to 340B drugs at contract pharmacies. So we already have 8 contract pharmacy access laws in place, 16 more introduced. So really about half of the states are sort of at play here. And it's been really interesting reporting on these because several of them have been states that introduced bills last year, but for whatever reason, often drug industry lobbying were unsuccessful in doing so and are reintroducing them and hoping for stronger effort this year. There are also some states such as Georgia, which I wrote about recently, where that state had not yet introduced a bill. And from speaking to some of the providers that had been pushing for it, they had really determined that because of Arkansas's law's legal success, they really felt that now was the time to push those laws. So there's been a lot of bills introduced that protect contract pharmacy access, and that'll certainly be an interesting thing to follow going forward.
And Will, what can you tell us about some of these bills that are gaining traction already?
Yeah, so outside of the contract pharmacy access bills, there's also, as Ted mentioned earlier, some 340B provider reporting bills. So right now, there are a total of 6 that have been introduced. They vary pretty considerably in terms of what specifically they're asking for. And you can go on to 340B report. We have a tracker that sort of outlines how each of these bills differ. But on one end of the spectrum, we have a bill in Colorado, for instance. It's combined with a contract pharmacy access bill. And that bill essentially just would require hospitals to report how much money and savings they generate from the 340B program and explain how they reinvest those savings back into their community. So that bill was backed by hospitals, and it has pretty much the same reporting requirements as the American Hospital Association's Good Stewardship Principles, which is a voluntary 340B reporting and transparency initiative that lots of 340B hospitals in the country already follow. So you have bills like that on the one hand. Then on the other hand, you have bills with much more extensive reporting requirements, like what we've seen in Indiana and Vermont. Many of those require, more than a dozen different items. And critics of the 340B program argue that those bills sort of bring transparency to the program that's not already present. But a lot of providers we've spoken to argue that they put a lot of burdens on the covered entities, are pretty duplicative with reporting requirements they already have through HRSA. And many have also argued that some sort of look engineered to create headline grabbing stories, such as what we saw in Minnesota about kind of the volume of 340B sales and lack some important context. So that will certainly be interesting to follow there. And then I guess the final type of bill, this is something we're seeing in Indiana, which is a completely different type of bill than what we've seen before. So the Indiana Senate did pass a 340B provider reporting bill, but the Indiana House has introduced, and two committees have now approved legislation that would require 340B hospitals to use all of their, basically to pass all of their 340B discounts directly to patients, regardless of patients in payer type or payer mix or any other characteristics. This is obviously a large departure from how the 340B program typically works and how Congress intended it to work, which is for, safety net providers to be able to use savings generated from the 340B program to both pass discounts to patients and also to fund other services for their communities that they would not otherwise be able to pay for. This bill significantly narrows that and basically says that you just have to give all of your savings directly to patients. So that would raise a lot of question marks about, hospitals, other services in that state. And there's also some potential legal challenges that could arise from that as well. So that is another type of bill among the many other types of bills that we'll be reporting and are really interesting for us to follow and keep track of.
Will, that's the Indiana bill is, I know, is quite troubling to the providers in that state and would be basically devastating and would undermine the very purpose of the program, which is to bring in revenue to expand access to care. It's really helping providers stretch scarce resources. I'm sure the providers in that state are working overtime right now to try to educate their lawmakers about this, because it would be basically would be handing over all of the savings from the program, including to insured patients, which doesn't make any sense. This is not supposed to be a program that subsidizes insurance and the insurance industry.
Yeah,
So,
and also important to note that Indiana is the home state of Eli Lilly, which definitely they create a lot of jobs there and have a strong lobbying presence, and then some health centers that have been really involved in the ASAP 340B movement, which is an alliance between health centers and the drug industry that sort of leaves hospitals out, are also based in Indiana. So it's definitely a very interesting political and lobbying climate there where this bill is originating.
yeah, that's a good point. Will, tell me, is this provider reporting bill, is it focused specifically on the hospitals, the one that would be basically would require them to hand over all the benefits from the program, or is it all covered entities?
Yeah, so the Senate bill, which is just provider reporting requirements, pretty straightforward. That applies to all covered entity types, but the House bill that would require passing savings directly to patients, that originally applied to all covered entity types, but during committee was actually amended to exclude community health centers and most federal grantees. So that bill, as it currently stands, that would require passing savings directly to patients, that one is specifically pretty much applying to hospitals in Indiana.
So, Bella, there's also been another interesting item going on throughout the red states of America, actually, also a little bit in the blue states, that is really trying to say some things about 340B that are frankly misleading, and are actually quite provocative. And I wanted to learn more from you, Bill, about what's going on with that initiative. Could you tell all of us?
Yeah, of course. So the name of the group behind that messaging is called Building America's Future. And it launched a 5-figure ad campaign in 4 red states, like you mentioned, that currently have contract pharmacy bills, including Kentucky, Nebraska, North Dakota, and Utah. And those misleading ads claim that 340B is, quote, subsidizing gender transitions for kids, and that contract pharmacy bills, like those in those states, are, quote, sabotaging President Trump's agenda. And they also, I mean, the point of the ads is to influence Republican lawmakers to vote against those bills. So that we've seen those ads as of late, but we've also seen conservative media outlets and some powerful voices, including an outlet called Town Hall, latch onto the campaign and repeat the false claims. One post from Building America's Future about the Kentucky bill caused a prominent conservative influencer to comment, and Donald Trump Jr., who's, of course, the son of President Trump, then also commented and spread the false claim that Kentucky's contract pharmacy access bill would subsidize gender affirming care for minors. Last thing is that the same group paid for trucks with LED billboards to run ads making the same misleading claims in front of state capitals in Kentucky, Nebraska, and North Dakota as of late during committee hearings on those bills. But it's important to note that Senate committees in Kentucky and Nebraska overwhelmingly voted to advance those bills despite the billboards outside. Well, can you tell us a little bit about why those ads are so misleading?
Yes, so the ads are misleading for a number of reasons. The first is that they claim that the 340B program is a taxpayer subsidy and involves federal funds. That's false because outside of the small oversight fee for HRSA, 340B discounts are entirely funded by drug manufacturers who can voluntarily choose to enter the 340B program in exchange for getting access to certain government health insurance or markets, but they certainly don't have to. Another misleading part is this idea that these bills would expand the 340B program. That's also false and misleading because the bills are not adding any new requirements on the program. They're simply preventing drug manufacturers from restricting the program. And if enacted, they would restore the program to how it was operating a couple years ago before drug makers in 2020 started to place restrictions on contract pharmacy access. And then finally, the most misleading parts in these ads are they're claiming that these bills in Kentucky, Utah, Nebraska, and North Dakota would, quote, as Bella said, subsidize gender transitions for kids. So in those states, there are laws in place that ban gender transition surgeries for transgender youth. The 340B bills, which restore access to contract pharmacy discounts, would have no bearing on those. The ads also have made claims that the 340B program subsidizes um, healthcare for undocumented migrants. That also is very misleading. They're basically insinuating that because safety net healthcare providers have to treat anyone that comes into their facilities, and some of those people that come into their facilities could be migrants, that's in effect a subsidy. I mean, it's sort of like saying, the 340B program subsidizes people with left hands just because some left-handed people are among the people that come to providers. And above all, it's very clear when you look at the history of building America's future that they're not really focused on any other specific issue beyond sort of creating controversy and outrage directed at these ads. And it seems like they're just sort of throwing stuff at the wall and seeing what sticks. They started out with arguments about legal immigration, then they tried abortion, and now they're trying gender affirming care. So above all, it's definitely a pretty cynical attempt to oppose these bills, and providers in those states, as Bella mentioned earlier, have really been strongly opposed to them, been opposed to this idea of a dark money out of state group influencing policy in their state. And as we've seen so far in Kentucky and Nebraska, key committees have approved those bills despite the dark money ads trying to oppose them.
Yeah, I think that it could potentially backfire. It's just so over the top that I think a lot of common sense conservatives will think, this is absolutely ridiculous. My rural hospital is really important, or my academic medical center is critically important to our state. But it's a crazy time in this country, and we will see whether they are effective or not. But so far, they have. It is backfired in Nebraska and Kentucky, at least at this point in the legislative process. So that's quite
Mhm.
interesting.
Yeah, and, and
Um,
and Ted,
yeah,
to your point, just sort of seeing the messaging that these providers groups are putting out has been pretty interesting, and they're sort of combating it by saying this is an out of state special interest group that is trying to tell people in our state, whether it's Nebraskans or Kentuckians, what they should do. They don't disclose their donors. They're based in Washington, D.C. They have nothing to do with us. So it's been interesting to sort of see the evolving messaging response to these Building America Futures ads. And we'll see if, as you said, it does ultimately backfire.
yeah, I think it's actually smart that the providers in those states are and the lawmakers are not ignoring the effort by to really undermine the program, because people hear these things and they might actually believe them. So it's important to combat misleading messages. And I think so far they've been fairly effective, the advocates and the lawmakers in those rural states. So it will be very interesting to see what ends up at the end of the day, and what gets passed and what doesn't. So I'll be really excited to keep an eye on that. And I know you will, and the rest of the team will be following all these never ending state developments. I mean, it's just every day there's something new happening. I always actually enjoy the beginning of the year, because it's when the state sessions are going on, and it's a lot of work for you guys, especially. But I think it's also stimulating and interesting. Would you guys concur?
Definitely.
And now we're going to take a break for a minute to hear about the sponsor of today's podcast. Thank you.
Eliminate double payments, ensure compliance, and achieve unparalleled transparency with RX Paradigm's 340B Clearinghouse. Powered by the Tungsten Plus platform, RX Paradigm aligns seamlessly with stakeholders' needs, enabling covered entities to deliver cost-effective care while preventing double payments from drug manufacturers. With RX Paradigm's collaborative 340B Clearinghouse approach, double payment concerns no longer justify network restrictions. Unlock a streamlined, balanced 340B management solution for all parties, and discover efficient, optimized 340B management today with Tungsten Plus.
Shannon, now I'm going to turn to you. I know there's been a lot going on in Washington. We've got some new leadership at HHS, both at the secretary level as well as a new head of HRSA. So tell us more.
Yeah, so before we get into the personnel happenings in the Trump administration, I'm just going to give a little bit of a recap on some things that we've seen on Capitol Hill with respect to the budget process. After a lot of talk over the past several weeks, we had House Republicans unveil and then start marking up their budget blueprint. And it's a pretty vague document that doesn't include a ton of policy issues, but what it does include is language that directs the Energy and Commerce Committee to come up with $880 billion in spending cuts over the next decade. And so because that committee primarily deals with the biggest health programs, which make up a large part of the federal budget, that's sort of teeing up potential Medicaid cuts or Medicare cuts. Mostly there seems to be talk more about Medicaid than Medicare. So we'll see what happens there. We haven't heard a ton of specifics. A few plans have been floated, but nothing solid yet. And then the Senate also started moving on a narrower budget bill. They're sort of pursuing a two-bill strategy, which is different than the House. So they marked up a skinny bill, as they're calling it, which just included language directing the HELP Committee, the Health, Education, Labor, and Pensions Committee, which oversees HHS programs, including Medicaid, Medicare, and 340B, to come up with $1 billion in cuts over the next decade. So we'll see where that lands. This is all part of an effort to help pay for President Donald Trump's requested tax cut extension and other GOP priorities. So we will see where those talks land and whether anything ends up affecting the 340B program. So far, it's just a lot of talk, but nothing substantial or concrete there. And then one of the biggest developments is we had the Senate confirm Robert F. Kennedy Jr. as the new HHS secretary. It's a vote that maybe a couple weeks ago was up in the air, might have surprised people that he got confirmed. There had been some pushback from Republican members, but the White House, J.D. Vance especially, really worked with the Senate to get them to a yes. And a lot of that vote hinged on the support of one senator, Bill Cassidy, who had raised a lot of concerns during the confirmation hearings in the Senate about RFK Jr.'s past remarks on vaccines. He's a noted vaccine skeptic who brought a lot of attention to the issue during the COVID pandemic and a little bit before that with measles outbreaks. So Cassidy ended up getting to a yes, and that sort of was the key vote he needed. And so with the vote in the Senate, there was only one Republican who opposed Cassidy or who opposed RFK Jr. for HHS secretary. And that was former GOP leader Mitch McConnell, who was a polio survivor and has been pretty outspoken about RFK Jr.'s past vaccination comments. And then we also had a little bit of a development at HRSA, the Health Services and Resources Administration, which helps administer and oversee the 340B program. We have a new administrator there, Tom Engels. He's a familiar face. He served as HRSA administrator under the first Trump administration, and he oversaw, or I guess announced, a big sort of reorganization of that agency right before Trump left office in 2021. So he is a familiar face in the 340B space. We haven't gotten a ton of indication on, whether he's got any sort of mandate to pursue any 340B related policy changes or any other shakeups at the agency. But that's sort of where things stand right now. And then also in Washington recently, the National Association of Community Health Centers held its annual conference, and they heard speeches from Bill Cassidy and also Senator Shelley Moore Capito. So Ted, I know you were at the conference. Do you want to give us a little bit of a rundown on what was going on there and what was discussed?
Oh, sure. So this is their policy and institute regular event that they have each winter, late winter, early spring, where they come and lobby the Hill. And it was about 2,200 people there. Is that right, Will? 2,200? So
Yeah.
a big audience.
Yeah, so the conference itself had 2,200 members, and then the actual room for that speech was pretty full, so it could have been close to that.
Yeah. So basically they had about 10 or 11 key lawmakers come, but the ones that we were really focused on, Will and I were both there, were Senator Cassidy, who's the chair of the Help Committee, which has jurisdiction over 340B, and he's been a big skeptic of the program, particularly of the 340B program, particularly the hospitals in the program, as well as a speech by Shelley Moore Capito. She is from West Virginia, also Republican, part of the Group of Six, which is a bipartisan group of lawmakers trying to restore access to 340B pricing in the contract pharmacy setting, but address a number of other issues related to 340B. First of all, Moore Capito reiterated that the G6 is not going away, even though they were not able to get a bill introduced in the last session of Congress. They will be introducing one this year. We don't know exactly when, but they said sometime soon. And then we also had, we were all waiting for Senator Cassidy's comments. Senator Cassidy said he is very interested in continuing his work on 340B. I think he would like to make some fairly significant changes to the program, including placing more restrictions on the program, largely placed on the hospitals in the program. And of course, that will get pushback from some of other members of the Senate, including potentially that Group of Six that is more, one would argue, 340B provider friendly. So it's going to be really interesting to see what happens. Senator Cassidy is highly influential because he controls the agenda on the Committee of Jurisdiction over 340B, But on the other hand, the G6 has Senator John Thune as its leader. At least it does now. Whether he can really focus that much attention to 340B now that he's now the majority leader is unclear. But I'm sure he will be pushing for policies that would be more friendly to the hospitals and health centers in his state. He has a really good relationship with them, and that dichotomy is going to be quite interesting to watch. We'll also have some really interesting situations here in the House with the Energy and Commerce Health Subcommittee Chair, Buddy Carter, who's a pharmacist and also shares Senator Cassidy's concerns with the program, taking the lead. But then there are some other folks on the Energy and Commerce Committee that are more supportive of the program. So it's going to be quite interesting. Of course, as you mentioned, Shannon, they all have their hands full with trying to get this budget reconciliation bill done, which is going to cause a lot of concern from the providers, especially with the Medicaid cuts that are being discussed, which are quite dramatic and quite scary. And so the providers in the program could be really hurt by those Medicaid cuts. As we all know, those who participate in 340B serve a disproportionate share of low income and Medicaid patients and are highly dependent on funding from Medicaid. So we're going to have a very, very interesting winter and spring, to say the least. So we'll be following all of that. I know, Shannon, you'll be spending a lot of time following those developments, as well as Will and Bella. So it's been a really interesting few weeks. I have a feeling when we do our next podcast in 2 weeks from now, instead of 16 bills having been introduced, it may be 20 or 25 contract pharmacy protection bills. And by then we'll have a better sense of which ones are going to make it through the legislature. Would you agree, Will, in the next few weeks will be quite important?
Yeah, definitely. It's important to keep in mind that a lot of these state legislative sessions, only go a couple months. Most of them are over by the summer. So if there's going to be movement, well, we'll certainly know pretty soon in most cases.
Right. And some of them only go for literally a couple months, where they ended at the end of February. So
Yeah.
we'll see what happens. And then it's interesting. There's certain states that only meet every other year, so it's always interesting. I think Texas is one of those states. So we will see what happens there and in other states. So with that, I think I'm going to wrap up. I want to thank all of you as usual. You guys have all been putting a lot of work over the last month or so, covering all the developments in 340B. So thank you, Shannon and Will and Bella. And we look forward to talking to all of you during our next podcast in 2 weeks from now. 340B Report is your indispensable source for news and intelligence on the 340B program. We are pleased to offer a special discount of 25% off for first-time subscribers. Go to the subscribe tab at 340breport.com and use coupon code podcast25. I know you will find our news service to be a valuable investment. Thank you.